And now, broadcasting live on Star Worldwide Networks, it's time for Your Road to Personal Addiction Recovery with Dr. William Nelson. If you suffer from addiction to opiate pain relievers, heroin, alcohol, or other substances, we're here to give you hope and help you overcome your addiction. Now, here's your host, Dr. Nelson.
Good morning. Man, I'll tell you, if you drive around anywhere in North Scottsdale, it's almost like when you're driving around in England, where you see a pub on just about every corner. And I'm not talking about pubs, I'm talking about yoga studios. And so it seems as though in the last 20 years, yoga has made to the forefront of culture. And it's interesting because usually a person's perception of yoga is quite different than the actuality of becoming a yogini or a person that practices. Yoga has a long tradition that's deeply enmeshed in the culture from India, and depending on the person, they estimate that it's been practiced in a similar form that's available now for 5,000 years. So some of the earliest cultures and very advanced culture. And the interesting thing is yoga has so many facets that it can be just a way to lose weight. It can be a way to, help with recovering from back pain or becoming more limber. And then it also, because of the way in which a person kind of aspires and continues to improve their yoga practice, it allows a person to enter this realm of understanding who we are, what do we mean, how do I fit in, and what is my life's purpose. So it can get into some very deep philosophical aspects. Or what happens, and which I make fun of a lot, is it can be a place that you can finally wear those Lululemon pants that you've been wanting to show off. And so with that, you're listening to Your Road to Personal Addiction Recovery. My name is Dr. William Nelson. Thanks for joining us. And today I have Anissa Hudak. I'm sorry did I pronounce your name right?
Anissa Hudak. Mm-hmm.
Hudak. Okay, Anissa. And Anissa has experience in yoga, and I'm really fascinated to hear about her perspective because Anissa has been practicing yoga for some time. She's a founder of a trauma healing yoga therapy program. And so we want to hear about how yoga can help with recovering from PTSD, trauma-related issues, and just how you can use yoga as a therapy. And with that, I'd like to welcome Anissa, and good morning. How are you?
Good morning. I'm very well, thank you. Thank you for having me on.
Yeah, definitely. So you were originally from Manhattan or New York, New Jersey area. Is that correct?
Right.
Okay.
Yeah.
And now you're in Manhattan, Kansas. So
yes.
You moved from one Manhattan to the other.
Yes, I left the Big Apple for the Little Apple.
Yeah, definitely. So I'd like to start by just getting a little bit of information on your background. How did you first learn about yoga, and what led you to pursue this, and just kind of go from there?
Well, I decided to take a yoga teacher training course because I didn't want to be on anybody else's schedule. I didn't want to have to go to a class. And I loved yoga, and I wanted to do it for myself, but I wanted to keep myself safe. So I decided, well, I'll take a teacher training class, and I'll be able to then keep myself safe. And within about a month, I had 2 job offers for yoga after I had completed the course. So I said, well, I think the universe is trying to tell me something. So I accepted these positions, and about a couple months later, I decided I'm going to take another class. And then I started getting the bug. I started taking more and more classes. And here in Manhattan, Kansas, we live right outside of Fort Riley, which is an Army post. And my husband was active duty. We had been active duty for quite a while. We knew a ton of active duty folks and vets. And here at Riley, troops were coming in and out from deployments. And so I kind of live in the belly of the beast here. One of the classes that was being offered was for PTSD for active duty and veterans. It's called Yoga Fit for Warriors. And so I thought, well, I kind of live here in the belly of the beast. It'd probably be a good idea for me to take it. And I got halfway through, I'd say the first day of the first class, and I realized that my own PTSD had really crawled into the nooks and crannies of my life and was holding me back. And so the first person I needed to really work on was me. And at that point, my journey really started. And quite frankly, my mat saved my life.
Well, so basically you're in there kind of hoping to learn about how to help others. And if I could paraphrase, you kind of learned that you first have to heal yourself from your traumas. Is that what you're saying?
Exactly.
Yeah.
Exactly.
Well, for someone who hasn't really even practiced yoga, and they may just have this, perspective of it that may or may not be correct. Can you just give, because when you say the word yoga, it brings up a lot of images. People have a preconceived idea of what it may or may not entail. Can you give the person who's not familiar with it a basic understanding of what exactly it is and how it's different from other forms of exercise and other forms of practice, meditative practice?
Well, you gave a really great history of yoga. But please note that yoga was actually created to help prepare the body for meditation. That's the whole purpose of yoga, to prepare the body for meditation. What a lot of us do, though, is we do, a half an hour or 45 minutes, maybe an hour on the mat, and then we don't do the meditation portion of it. Some folks do meditation and don't do the yoga portion. Yoga is comprised of a lot of different parts, and most people think that it consists of a mat, a person doing poses, maybe some funny breathing, maybe some chanting, and it's all those things and a whole lot more. The beauty of yoga is that you have to be present, and especially in our day and age, we're never really present.
I'm laughing because we had a conversation last week, a person that was a physical trainer and a coach, and that was their number one goal, is to be present. Like whether they're at their work, they want to be present with their work, and when they're at home, they want to be present with home, not thinking about something else. So, and I brought up the fact that in yoga, it's impossible, next to impossible, to be thinking about something else when you're trying to do a difficult pose or stay in a position that is a lot of tension, and you have to breathe and focus. So it's funny that you mentioned that, but it's so true.
That is the biggest thing is being present. It really is. You can't think about your laundry list, your grocery list, picking up the kids in an hour, whatever. You're going to fall over.
Mm-hmm. And no texting allowed during the...
No texting. No. I asked for phones to be turned off, in fact.
Yeah. And that may be, for some people, that may be the half hour or the 1 hour of their day where they're not constantly waiting for that little ding to hear that they got a text message or a like on their Instagram.
Now, I will say that there are some caveats to that. Sometimes in my class, I have folks who are caregivers, and they have to be available by phone.
Right.
And so, their phone is next to them. It's quiet, but that way they can at least see it and hear it if someone needs them.
Sure.
And so there are some caveats to that.
Yeah.
But generally speaking, especially for folks who have PTSD, and if I'm working in a class with just folks with, trauma and PTSD and not caregivers, I make them turn off their phones because, quite frankly, technology is an addiction as well as drugs, alcohol, and what have you. It's one of the main 7 addictions. And we're finding that a lot of folks with PTSD and trauma issues are addicted to technology as well.
Sure.
So that might be the only half hour or hour that they are unplugged, and they, quite frankly, don't even know what to do with themselves.
Mm-hmm. And then, so when you describe yoga, and you had mentioned it previously, there's so many different aspects to it. What's the best way for someone who's never even kind of thought that they might want to, look into yoga? What would be the things that you would tell them to look for? Because as much as we'd like to have you here in Phoenix and in Scottsdale area, you're quite a ways away. So what would a person that's looking for someone, the proper or the most appropriate class for them, say? And let me be more specific. I have so many patients that I deal with that have PTSD. It's the underlying cause of their addiction, and a lot of them aren't really excited about going into talk therapy. They've been there, done that. They've done intensive outpatient, which is when you get in a group and talk about your history with drug use and your struggles with rehab and recovery. And so often people are just like, I don't want to talk about it. I don't want to deal with it. I'm moving on. And yet I understand, and we all kind of are at some level know that so many of those things that are driving us in a direction that's inconsistent with what we say we want. So a person who's addicted to alcohol or drugs or opiates, and they say, I really don't want to use anymore, and they find themselves like a moth to a flame, continuing to delve into that realm that they don't want to pursue. I think in probably 90% of those cases, it's because of this underlying trauma, PTSD, or emotional or physical abuse, where that event and that emotion that they experienced during that time was so overwhelming that they stuff it down and it's stuck in their body. So literally imprinted on their, whether it's in their chakra or their acupuncture meridians or in their organ system based on your paradigm. How does one choose a yoga practice or get into one if they've never really experienced that? What kind of things would you suggest they look into?
Well, I would say that you just opened up Pandora's box with that question. And so I would say yoga, if we think of yoga as a big piece of pie, a big pie, a whole pie, and you have fitness-based yoga and you have therapeutic yoga. Now, in the fitness realm, you've got Ashtanga, Bikram, hot yoga, all kinds of different yoga. And then in the therapy side, you've got yoga for arthritis, yoga for cardiac rehab, yoga for cancer. So we're all specialists. And I would say, first and foremost, you need to find someone to meet your needs. So you need to do a little research. Don't just go walking into your corner yoga studio, because although that person who's leading the class is probably very, very well trained to lead the type of class they're leading, they may not have the educational background to help you if you were to be triggered on your mat, or if you were to have an abnormal emotional release on your mat. They may not know how to handle it, and they might actually kick you out of the class.
Oh my gosh, yeah. I can imagine.
So it's about keeping everyone safe.
Mm-hmm.
And so there are certain protocols that are in place. And so you really want to have somebody who can meet your needs. So know what your needs are and find someone to meet your needs. Now, that being said, I am available online. So though I'm not in Scottsdale, you still can get in touch with me.
Okay. Oh, so if someone wanted to,
go ahead.
If someone wanted to have some coaching, or you could work with them virtual or with a coaching program, and maybe give them postures or a practice, or help them, guide them in the process without actually physically being there.
Correct.
Well, that's awesome. That's really good. And so this would be one-on-one. Do you normally do one-on-one sessions, or do you have group sessions, or is it a combo?
I do all kinds of things. And I'm also creating a membership specifically for women who have been sexually traumatized. And that's going to be launching here in late winter, early spring. And it'll be 24/7 access to recorded yoga therapy classes. Because, at 3 a.m. and your mind is racing, it's great to be able to jump on and get a class in to help quiet the mind.
Wow, I'm just listening to that, and it's like, that sounds amazing. I'm sure that's
Thank you.
huge need that will be very, very helpful for so many people.
Now, that being said, I do also do one-on-ones virtually, and I can do groups if people want to get together and do a group. I can do that too.
Okay. So a question, if someone was, so is there, I know you said you're working on the one for the sexual trauma victims. Do you also have something available currently for an online kind of coaching program or pre-recorded or a membership?
That is coming soon as well. Right now, though, I'm just meeting with people one-on-one in live real time.
Okay. Wow, you're busy.
Yes, I am.
So your yoga practice for you is something that helps you stay present and helps you clear your mind and make sure you're most effective.
Absolutely. It saves my life. My own personal practice saves my life.
Yeah. You mind me asking, you had mentioned that you had some trauma. What was your trauma, or what was it that you struggled with?
Well, I think I have the distinction of knowing PTSD and trauma quite intimately. I don't know if that's something to brag about or not, but I grew up in an alcoholic home. My father was a Vietnam veteran, and it really kind of spurred his PTSD, spurred his alcoholism. And I'm happy to say that he is now sober almost 22 years. And just in the last 3 to 5 years, he went to the VA and he's been able to get services, counseling and what have you. And he's finally been able to let go of those burdens that he was carrying around.
Wow.
And it is so amazing and so beautiful to see. And I'm so proud of him.
That's amazing. That's so cool. Do you mind me asking, what was it that helped with him? The services that helped?
Therapy.
Mm-hmm.
He had group therapy. He had one-on-one therapy. They did put him on some medications to help because of the nightmares. I mean, he still had nightmares.
Wow, for 20 years.
Well, more than that. I mean, he Vietnam vet.
So okay. With the you're saying the addiction was 20 some odd years, or no? His sobriety was 20 years.
Yes.
So sober for 20 years, but still suffering with night terrors and the PTSD. Got it. Okay.
Yeah. So, he's been working hard.
Yeah,
but it's really been beautiful to see.
Yeah, I'm sure it is. And how about you? I know sometimes it's the most difficult person to work with or to provide help or guidance or therapy, or with doctors' cases, to treat their family treat their family members, because you're so enmeshed and your emotions are kind of so involved where you it's hard to have a perspective and have some level of boundaries. Were you able to help him with any yoga, or was he open-minded to that?
He enjoys yoga. He likes to do it in Aruba on the beach.
I don't blame him.
You're right,
Yeah.
So yes and no. I've given him some yoga nidras, which is kind of like a guided meditation, kind of. Mm-hmm. Those have been helpful for him. It's kind of difficult, and you're right, boundaries. Part of me wears the daughter hat, part of me wears the clinician hat.
Mm-hmm.
And so sometimes it's really hard to differentiate between the two emotions,
yeah.
The factual, the emotion. I try to actually stay out of it.
Yeah.
I'll ask him what he's doing, what he's up to, where he is in therapy. We'll talk about it. I might offer him suggestions, but I actually try to take a hands-off approach because I want to be there as his daughter, not as his clinician.
Yeah, yep. Sounds good.
And so that's kind of my focus. So growing up, I mean, it wasn't a terrible childhood, but there was always this undercurrent.
Mm-hmm.
He was never a mean drunk. He never beat us. It wasn't anything like that. But there was always this undercurrent of maybe, I guess you would call instability.
Right.
I then suffered my first rape in my first year of college. I then, afterwards, got married. I had a very traumatic first birthing experience with my son. My second birth, my second pregnancy, I actually lost a child. And so I have a twinless twin. And then about 4 years ago, I suffered another rape.
Mm.
So I kind of know trauma.
Yeah. Well, at that point, you had already been established in your practice for quite some time?
Yes.
And so you were able to, were you able to fall back on some of your training and some of your experience to help you with that, or was it because it's your personal trauma, it's kind of hard to do that? Did you need some other help and other guidance?
I am all about medication. I am on medication. I will probably be on medication for life. I know that mental illness runs in my family, and I know that I need something to help me. So I am on meds. I'm not ashamed of that.
Mm-hmm.
I also see a therapist. I'm not ashamed to say it. Being from New York, we all have therapists. So.
Well, I know. I think. Well, it's funny because you say I'm not afraid to admit it or not ashamed. It's like I think sometimes in New York or in Manhattan, it's a status symbol.
It is. Well, who are you going to? Yeah.
Oh, right. Yeah, it's like, yeah, exactly. Yeah.
I will say that I have an amazing therapist in Kansas City. I drive actually 2 hours one way to see him.
Wow.
And he specializes in sexual trauma.
Yeah. Yep.
So I'm very lucky.
Yeah. Well, it would be luckier if it were a 2-minute or a 10-minute drive than a 2-hour drive. But yeah, the fact that you have access to that and you have the ability to pursue someone who's really skilled at helping is super important. So I'm glad that you have
it. It
that.
is, but again, it's knowing what your needs are.
Right.
You know, and so no, I'm very, very lucky. I have been able to do a lot of work with him, and you know, it's a combination. Your healing journey is a very individual thing. It's like your thumbprint. And just because this one protocol works for one person, it doesn't mean the same protocol is going to work for someone else.
Man.
So you really need to find what works best for you.
That is the understatement. Whether you're dealing with PTSD or the sexual abuse or rape, you're a rape victim, or in the case that the predominance of the patients that I see, they have one or many of those things. Then on top of it, they have this addiction to a drug that's predictably going to kill them unless they can figure out how to stop. Mm-hmm. So I have a patient that's scheduled today, and I saw him 2 years ago, and he was very addicted to opiates and found a way to become sober. And then Anissa, the treatment that I do is I do something that's called a naltrexone pellet insert. That's when I do a minor surgical procedure where we put a medication that is released into the body 24/7 for up to 4 to 6 months. And while that drug is being slowly released into their body, it makes it impossible for them to use their drug of choice, the opiate, heroin, or fentanyl, which is predictably going to kill them. It's killing 6 people a day, even in just in Arizona. So in the process of doing that, that's one aspect of what they need to do. But this other aspect, and what you're describing, is so true. It's like it's the reason why we're having such difficulty with recidivism, and 90% of the people that are treated in an inpatient detox and rehab facility will relapse within the first year. And at the tune of $1,000 to $2,000, or at a fancy pants place, $3,000 a day. All of that money and all of that effort isn't being optimized because our medical paradigm and how we practice medicine, especially in addiction, it's so cookie cutter. And it's like they have one program, one size fits all, with very little room for any sort of, customization or, so I took 2 minutes to say what you said in one simple sentence, is that it has to be, more specific. And so I think that for a lot of people, that's hard to figure out. How do you find yoga, or let's make it very specific. What were the questions a person could ask, either themselves or a yoga practitioner, as to whether or not yoga would fit into their recovery, whether it be from, sexual trauma or that plus their addictions with drugs or alcohol?
Well, it's kind of a two-pronged question. So let me answer part of it first here.
Okay.
What I suggest for all my clients is that they get a book, a notebook, whatever, journal, whatever.
Mm-hmm.
And every time they try something new, whether it be an essential oil, a type of massage, a type of yoga, whatever it is, they write it down in this book. And they write about it. Did it work for them? Did it help? Did it not? And then in 6 months, go back and try it again. And that way they keep a log of what they've tried, and then they can go back and try it again. And the reason for that, and try it every 6 months, after a year, try it again, 18 months, 24 months. The reason being, you are a different person at that point. And you're at a different point in your journey. And so what worked for you at 6 months may not work for you at 12 months, and vice versa. So you got to keep trying things.
Yeah.
You can't just write something out and say, oh, I tried that, it didn't work. It doesn't matter.
I'm looking across the room at my producer, and Robin Cote is just shaking her head with a big smile, big time.
She's so right.
Yeah.
Everybody gives up because they think it's
Yeah.
one size fits all, and it's not. She's exactly right about that. You've got to find what works for you.
Yeah. I've heard so many people say that. They're like, oh, I tried that. That doesn't work. So, man, that is such sage advice. Anissa, that's really great advice, and I'm going to use that. So thank you so much.
I want to say something to her.
I'll send you, or you can send me the bill.
Absolutely.
Yeah, I want to say something to her
please.
as a person who survived domestic abuse and numerous sexual assaults throughout my life. Keep doing what you're doing, girl. You're brave, and I really commend you for going the extra mile, even having gone through this not long ago, and now structuring classes for women who are victims of that as well. That is amazing. So thank you as being a victim of sexual assault numerous times. That is awesome. Thank you.
Thank you.
Yeah, I second that. I second that. One of my children was subject to an abuse, and I couldn't deal with it, because of my fatherly instincts, and my initial response was like, I'm gonna effing kill that person. I was like, that's my sophisticated response. And but yeah, I so am with Robin. Thank you so much for all your love and energy and attention that you're doing, and such a good perspective. I'm really appreciative of what you're doing, and I can't wait until I can refer people to your program.
Well, thank you. I really appreciate that. It's been a journey, and it's still a journey. And, some days are better than others, obviously, but it's a journey. And I think people also need to understand that, this is a marathon. It's a journey. This is not a sprint. You're not going to sprint to the cure. This is a lifelong journey. It's like having diabetes or arthritis or something to that effect. You're going to deal with this probably the rest of your life. But how you deal with it is the question. Is it always going to be in your face, or is it going to be something that's manageable?
Yeah.
And you have that choice.
Yep. No, I think that's another really sage bit of advice, is that I think just our culture in general, and it seems as though with each subsequent generation, I think about the things my grandfather used to say and the things that my dad used to say, and now I find myself saying those same bits of advice or bits of wisdom. And I think each generation we become more and more impatient. It's like I was talking with a person that does recruiting in colleges, and they said, it's interesting. People coming out of college today, if they don't feel their career path is going to allow them to be in the executive board in the first 6 months to a year, they're not interested. It's like, I'm going to be vice president in a year, and realizing that all the people that are in those positions have 5, 10, 15, 20, 25 years of experience doing what you're going to go in there and step in and learn and be a leader in 6 months. So, and I think that applies to so many other aspects. If someone wants to lose weight, we had someone on last week, and he said the biggest problem with people's New Year's resolution is they want to lose 30 pounds in the first 30 days, and then, the next 30 days lose another 20. And setting unrealistic expectations with unrealistic time frames. And as it applies to detox and rehab and recovery, I think it applies to both the parents of the addicted loved ones and the family of the addicted loved ones. The first time they go to a detox and rehab program, they'll think, okay, this is the greatest addiction detox and rehab place on the planet, and my child, my loved one, is going to go in there, and in this 30 days, they're going to heal. And they're going to be sober, and they're going to be in full recovery, when that's not at all, realistic. And I think I spoke to one of my patients the other day, and a person that had been addicted to opiates for 16 years, 19 until 35. They said, I'm gonna give this a shot for 1 year, and if my life is better, then I'm going to continue. But after 1 year, my life isn't in a better place, I probably will just start using again. And I listened, and I kind of shook my head, and doing my best to listen and be receptive, but kind of put it in perspective. How could you expect, after 16 years, only given it 1 year, to make that evaluation? And I said, even if it takes you 16 years, if you're sober, you're not going to die from sobriety, but very well you may die in your next time out and use your drug of choice. So I think this, one of my children, I still remember, I crack up because we're so used to immediate gratification. We were out and they asked for some sort of toy, or I can't even remember what it was, a piece of clothing or some toy that I didn't want to buy because I didn't feel I wanted to spend the money. And in trying to be honest and transparent, I said, no, we're not going to do that. I just don't have the money to do that. They're Dad, simple. There's an ATM right over there. We can go get the money right now. I'm like, no, you don't get it. So kind of how I bring it back full circle is like the unrealistic expectations. Do you find that people, if they are really getting into a yoga practice, does it help with patience? Because I think that's one of the challenges with someone in recovery.
Yes.
Yeah.
One of the main reasons I do yoga is because I have no patience.
Yeah.
And so I find, especially after extended times on my mat, that I am a little bit more subdued. I am more patient. I'm kinder. I'm nicer. I'm gentler. And that's why I do it. For me, I also tried martial arts. Mm-hmm. And I think martial arts are great. And for some folks, that is what they need to do. Mm-hmm. Because yoga is not the answer for everyone. And that's totally cool. But when I did martial arts, it kind of revved me up.
You got more aggressive.
I became more aggressive.
Oh, man. Yeah.
And I wound up getting my butt kicked. And then I realized, okay, this is not for me.
Yeah.
Thankfully, it was my very good friend, and she was a world champion, and she looked at me and she said, okay, I'm going to have to kick your ass right now. And she did, and she said, I think you're done. I think you need to hang up your belt. And it was a good lesson in humility, that's for sure. And she's still my friend. But I realized it made me way too aggressive, and I can't handle that. But yoga is my gig.
Yeah.
And so I would suggest for anyone who wants to try yoga, when you find someone, go and try them out, and try them out like 5 or 6 times.
Okay.
Don't go to just one class. Go 5 or 6 times. Part of yoga is you kind of get a sense of, the sense of the class, the rhythm of the class, how the teacher teaches the class. Do you like the teacher? If you're going to have to spend an hour with this person and you're going to pay them, you should kind of like them.
Yeah.
And so if you don't like the class, you don't like the rhythm, you don't like the person, find someone new. Again, keep trying. This is not a one-size-fits-all. We're not all circus monkeys. We all have personalities. We're all different. Just because we're yoga therapists or yoga trainer or whatever, we're not all the same. We all bring something different to the table. So try.
I'm thinking still about back to your the notion that the true goal or the purpose of yoga is to prepare for meditation. I don't see a lot of yoga studios that have like the studio and then, right next door is the meditation room. So do you recommend, or in your class, do you have a certain portion of that class that's just for meditation? And when you say meditation, is it seated, motionless meditation, or can that be a part of the movement with yoga?
Well, yoga is considered a moving meditation.
Okay.
That being said, I'm kind of the feeling that, everybody thinks that meditation is you're seated, there's, strange Indian music playing, there is incense burning, people are chanting. It doesn't have to look like that.
Yeah.
It could be going for a walk with your dog.
Got it.
It could be, maybe just lying still. Now, yes, in my class there is a portion, it's called Shavasana, which is final relaxation.
Mm-hmm.
It is at the end of the class. Now, generally every yoga class does this. It is probably the most important part of the class because that's where you actually do the inner work.
Mm-hmm.
What's different in my class as opposed to a fitness-based class is, in a fitness-based class, generally everyone lies on their back, on their mat, kind of spread eagle, palms facing up towards the sky, closing their eyes, and they lie still for anywhere between 5 to 10 minutes. That doesn't happen in my class because that could be so triggering. So in my class, the first rule of my class is that there are no rules. And when we come to Shavasana, you can lie any way you want to lie on the mat, on your side, on your belly, pillows, blankets, whatever to make yourself comfortable. And then during the time of Shavasana, I leave the lights on. But I have eye pillows available in case anyone wants to block out the light.
Mm-hmm.
That's their choice. And instead of just listening to music and lying still, I read. I am not a therapist. I'm not a social worker. I'm not a trained psychologist or anything like that. I'm a yoga therapist. My goal is to release trauma from your body.
Mm-hmm.
And that being said, I don't ever want you to be alone with your thoughts because that's where scary shit happens. Let's be real.
Mm-hmm.
And so I read.
Okay.
I read all kinds of stuff, poems, excerpts of books. I read about essential oils and the emotional value of essential oils. And it's funny because people will pop up after Shavasana, and say, oh, I want to try that oil.
Mm-hmm.
And so that's what happens during our
Okay.
quiet meditation time.
Okay. I have a question, just personal question. What does it mean after a yoga session during Shavasana where the participant, namely me, probably 8 out of 10 times just falls asleep? And the guy get sometimes woken up, you're snoring. And they're like, okay, sorry.
I consider that a high honor.
Well, okay, good.
I consider that an honor because you felt comfortable enough in my presence to be so vulnerable that you fell asleep.
Yeah, but not everybody else felt honored. You're like, that dude's snoring and it's annoying.
Well, yeah, and in a fitness-based class, yeah, you're probably going to get, laughed at.
Yeah.
And it's funny because sometimes even in my class, we'll all kind of like joke and, all right, who snored the loudest?
Yeah. Yep.
But that's an honor.
Yeah. Well, and it feels so good. Yeah.
Yeah, and that's what your body needed in that very moment. You are honoring your body.
Mm-hmm.
That's what a brilliant thing.
Yeah, I don't know for me if it's so cognizant. It's just like I'm relaxed and you just got rid of tension, and I'm kind of, and I will be in a place where I'll be meditating. Usually it's silent, and I'll be meditating using my mantra or what have you, and then I'll just go. I'll just go, and I'm like, I couldn't even remember feeling tired, and so just going into that deep, kind of probably very restorative sleep too.
Yeah.
Awesome. So
can I circle back to the
yes,
second prong of that?
Please do.
Okay, great. So the way PTSD works, and I don't know if you've had this discussion yet on your show, and stop me if you have.
No, please do. I'd love to hear this.
Okay. So have you ever seen two dogs fight?
Yes.
What happens afterwards?
Usually they kind of make up. They kind of fight, and then I don't know when you say.
Kind of walk.
Go ahead.
Okay, so they walk away from one another, right?
Mm-hmm.
And as they're walking away from one another, they shake.
Oh, okay.
Have you ever seen that?
No, I don't think I have.
Okay, so every animal, no matter what kind of, if they've had some kind of a scuffle, as they're walking away from the scuffle, they shake.
Okay.
And that shaking is absolutely the key to everything.
Okay.
In our everyday life, we live in the upper echelon brain. We have two brains. We live in the upper echelon brain, and that handles all of our critical thinking. So, math skills, making our grocery list, like all that kind of stuff.
Sure.
But then we also have the reptilian brain. And in the reptilian brain, that handles all the stuff that we never think about. Breathing, blinking, belching, all that kind of stuff. Mm-hmm. It also is where the fight and flight is in.
Okay.
So that's where that whole mechanism. And anytime we are in a traumatic experience, our brain reverts to the reptilian brain, and all systems are going there. So in order for us to switch back over, after the trauma's over, for us to switch back over to the critical brain, we need to shake. That is how we reset our central nervous system.
Hmm.
Well, what happens when we don't do that?
You remain at some level in that reptilian traumatic fight or flight.
Exactly. And thereby, we've got PTSD.
Got it.
What we're able to do in yoga therapy, and the type that I teach, is we are able to, your body traps that trauma on a very cellular level.
Yeah, exactly.
And there's certain muscle groups that we actually hold it in. And so in my class, we work those muscle groups to exhaustion to make them shake.
Oh. Cool. I love it.
And so that's the essence of what I do. I literally make people quiver.
Okay.
Now, you'll get a full body workout because we have to work out the whole body in order to get into this very deep muscle group.
Mm-hmm.
And so there's a whole, it's all scientifically kind of worked out, and, we do it this way. We work this muscle group to exhaustion. You may or may not feel the shaking. A lot of my clients will say to me, oh, gosh, my thighs are shaking. Yep, that's good. Sometimes they don't feel it, but they'll say, I feel lighter. Great. You've let go of some baggage.
Right.
So when you add this kind of, shaking and central nervous reset, along with being present, along with, giving yourself an hour, just giving yourself an hour, and then you add to it talk therapy, and you add whatever other therapies you're doing, you're talking about a comprehensive healing journey.
Yeah.
Meds and talk therapy are not going to do it all.
Right.
You have to release the trauma from your body.
Yeah, I think that is. I'm so intrigued because I'll just say it's such an unmet need because, especially with your training and your perspective, you understand exactly the goal. And I think a lot of people, they're just doing yoga because I like to stretch or I like to do this, and with the goal orientation of releasing that stuck energy. And a lot of people, they don't even understand the concept. But you don't have to understand it to work that muscle, and then all of a sudden you feel it, and then you feel your emotions and your perspective shift. I know for a fact that I have a bunch of people that I want to refer because a lot of them are shaking. Even they're like, I'm so anxious, and during certain times their body will shake, and that's the energy that wants to leave, but there's no venue and there's no vehicle for which to release. So it sounds amazing.
Exactly.
Yeah.
Exactly. You have to be able to channel it. And that's why if you go to your corner yoga studio and you try to get on a mat and do this, they are not going to have potentially the education to understand what it is you're trying to accomplish.
Right.
So you have to really make sure you get your needs met.
Right. Anissa, it's hard to believe, but we're coming up at the end of the show. So I want to thank you so much for coming on. And I have your contact info, and then I can give that to Robin, and we can list that on the podcast. And then, but if you'd like, let's do it. You tell us out loud of how people can get a hold of you, whether it be for personal coaching or to be informed about when you complete these online programs. I just thank you so much for the work you're doing and coming on today. It was really insightful, and I'm so appreciative of you, of what you're doing.
Well, thank you, and thank you for the work that you do. And I appreciate you having me on today. Thank you so much. You all can find me at www.traumahealingyoga.com.
Okay, perfect.
That's me.
Okay. So this is Dr. William Nelson. Thank you, everybody, for joining us for another edition of Your Road to Personal Addiction Recovery. Thanks to Anissa for coming on and sharing her insight and all of her knowledge regarding how we can use this ancient traditional practice for today's most pressing problems. Thanks so much.
Thanks for listening to Your Road to Personal Addiction Recovery with Dr. William Nelson. Listen live each week at this time or anytime 24/7 on demand at starworldwidenetworks.com.